Hey everybody, welcome back to another episode of Dentistry Unmasked. My name is David Rice. I'm here as always with...
Hey everybody, Pam Maragliano-Muniz. I am so excited for this episode. Oh my goodness.
Can't imagine why.
I know. It's like, oh my God. It's like having two of my favorite people, not including you because you already know that, as a guest. Oh my gosh, this is crazy. No, Dr. Mia Geisinger, Katrina Sanders, like power... I don't want to say power couple, but like power lecturers.
Wait a second.
like power lecture partners, and just you're amazing individually. You're like ridiculous collectively. Welcome, both of you.
Thank you so much for having us.
Yeah, I'm excited to be here. And this is just such an exciting time for us to be here because Dr. Mia and I just finished doing a collaborative lecture here at fabulous RDH Under One Roof.
Ooh,
Yay.
do tell.
We had so much fun. The title was The Chronic Disease No One is Talking About. And we got to unpack kind of the chronic disease of apathy or fear of telling patients about their periodontal diagnosis in a meaningful way and really looking at patient-centered care.
Mm-hmm. Yeah, and it's amazing being able to do this, periodontist and hygienist, in the same room together.
Yeah.
To be able to demonstrate that there is so much collaboration that's happening. Although I'm in my operatory and Dr. Mia is in a different practice across the street or whatever might be happening, that there's so much collaboration that happens through patient care. And I think that's our opportunity to really kind of take a step back, rewind, and look at where can we be better advocates for our patients. So our program today really dove into that. And that apathy piece, I think, is such a poignant aspect that we've been hearing about quite a bit here at RDH Under One Roof.
Yeah, how do we switch our mindset? How do we go from a mindset of checking the clock, stamping the chart with, cut and paste 3, 2, 3, to a mindset where we're saying, we are going to center the patient. We are going to make that patient a co-practitioner with us in how we manage that disease. And by doing that, we are going to do well for our practice. We're going to feel better about how we're treating patients. We're going to feel more accomplished as healthcare professionals. And we're going to know at the end of the day, when we go home, we're making a difference, not just with their oral health, their caries, their periodontal health, but with their overall health as well.
Mm.
Well, let me ask you this. I want to get back to 1 second. Why are we so afraid to tell people that they have periodontal disease? Like why, if I had cancer, like I'd want to know, like if I had like a fungal infection on my toe, I'd want to know. I mean, no matter how serious or not serious, I feel like we should know, but yet as dental professionals, we get so much training and then we're afraid to tell our patients about it. Like why?
Yeah, so I'll share on the hygiene side because this actually really resonated with our audience. It's amazing. I ask dental hygienists this consistently. If a new patient came into your practice and you hadn't touched them before, and even better, what if that new patient said, I haven't been to the dentist in 5 years, 10 years? You list out that time interval. How easy is that for you to explain to that patient, you have periodontal disease, we need to perform this non-surgical therapy, and yada, yada, yada. It's a lot easier than, for example, your existing patients who've been coming in 3, 4, or 6 months. I think part of the challenge is that dentistry has such a strong continuity of care. In fact, I would even argue we have a stronger continuity of care than most patients have with their primary care physician. So while a PCP may say, you have high blood pressure, and that's due to a whole host of, and we're going to make a list of all of those lifestyle implications, genetic issues, risk factors, etc. In dentistry, I think because we have so many touch points with the patient, there's this fear that we own some of that. Like maybe I didn't do a good enough job at your prophy when you came in 6 months ago, and now I have to explain to you where this disease process comes from without feeling like I'm responsible for giving you the disease.
That's a great point.
I think that's absolutely true. And I think in many ways, as consumers of healthcare, if we went into our PCP and we had been there last year and they said, you have hypertension, we wouldn't assume that they gave us hypertension or they have been ignoring our hypertension. We would say, okay, what are we going to do about it? How do we manage this hypertension? But our perception as dental healthcare providers is that our patients are going to knee-jerk blame us. And I don't know that that's the case. I think if we spend the time to talk to them about the multifactorial aspect of this disease and all of the other things that can contribute to it, they're then with us looking for a solution.
I agree. I feel like we project our mojo, juju onto the patient, and then they're like, well, okay, what did you do? But that's us leading that charge.
You're spot on. In fact, I want to share something else that was really amazing that happened in the room, and they just fell right into it. I'm sure you saw that, Dr. Mia.
Yeah.
So we were talking about a research study that was done, and this has been replicated actually several times, and they get the same conclusion every time. This research study looked at patients who have perio. They received that diagnosis, they received the treatment plan, and they said no. So the whole crux of the research study was, why did you say no? And so we asked the room, why would patients say no to this? You've been told you have active disease. You've been told you need to be treated. The patient says no. Why is that? And just bubbled up from the room was, insurance won't cover it. The cost, it's too expensive. All of the things, right? And ironically, the number one reason, resoundingly number one, why patients decline our perio treatment plans really go back to a lack of trust in the dental healthcare professional. But to your point, when we believe, it was just a gut reaction for the professionals in that room. When we believe it's about money, then it's amazing how that influences. Maybe it's not a 4. Maybe that's a borderline. I'll call it a 3 today, and then maybe I'll reprobe it next time. And that regression to the mean we've seen in data as well, which is really compelling. It says even though we're human beings and we're calibrated on how to probe a patient, that our clinical decision making is driven by the circle of that humanistic quality of our patients. How well we know that patient. If that patient comes in and says, I just lost my insurance because I'm going through a divorce, doesn't that augment some of the care plan that we feel comfortable putting in front of that patient, instead of thinking, so you must be stressed. So you must have higher inflammatory markers. We need to talk about you taking care of yourself through this entire process. So we oftentimes abandon the medical need and kind of go to more of that humanistic need.
And I think, too, if we are not fully committed to the fact that the care we provide is valuable and is important for their oral and overall health, then why should the patient believe it? If we're sort of hedging our bets when we're having that conversation with the patients pick up on that. They see us being like, well, you have a little bit of bleeding in here. There's some inflammation and progression, and that to them is not something that they can grab a hold of as a diagnosis. When we start to make a diagnosis and we say, okay, you have stage 2 grade B periodontitis, and here's what we have to do to make sure that we don't see progression of this disease. And we're so glad you came in and we caught it at this point, because we're still at a point where non-surgical therapy is the ideal therapy for this treatment. And we don't want you to have surgery, despite rumors to the contrary about dentists and all the Steve Martin movies out there. I promise you, we don't want to hurt you, right?
It's true, and I think it's interesting that we as dental professionals use that phrase, a little bit of this, like just a little bit of this, like it's okay. And I think we were taught to accept everybody bleeds, like somewhere, a little bit. Even the best ones bleed somewhere a little bit. And we've made the acceptable unacceptable, at least in our practice. And having 0 bleeding points is achievable. And instead of saying, oh, you have a little bit of bleeding here, we've got the perio chart on a TV right in front of everybody. And we're like, not we, my hygienist. I just get to walk in and say yes. They count it up. They're like, you have 1, 2, 3, 4, blah, 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 and that many bleeding points, that many areas of bleeding. And if you've got inflammation in your mouth, you've got inflammation elsewhere in your body. And I love that this conversation starts at the medical history.
Yes.
Because if your family has a history of Alzheimer's or high blood pressure or a stroke or 57 other illnesses, they don't want it, especially if they're taking care of a family member with this illness. They're going to want to do everything they can. And when they realize there's such a strong link between this and that, you already have them on board. You haven't even probed them yet.
Yeah.
So I don't know. I feel like we've got such an opportunity, but what a cool opportunity for you guys to convey that to dental professionals, to not be fearful, because patients oftentimes, once they understand it, they get the care that they need. They say yes, and they don't worry about third-party payments. They don't worry about some of these things.
True.
You know, or whatever their concern is with the third-party payment might not even be a realistic concern. It's just a perceived concern.
Or it's what they tell us because they don't want to say to us, hey, I don't trust you. I don't think you believe what you're saying.
Mm-hmm. You know, I think a deeper layer to this, particularly for participants sitting in my rooms, is they're always thinking about the extreme patient. So they're not thinking about your average reasonable patient. They're thinking about the extreme case, the angry patient who comes in, arms crossed, I'm not going to do anything that my insurance doesn't cover. And they tend to look at these new ideas about integrating advanced assessments or having the dialogue about a medical history as something like, my patients don't want that. And the irony is, once you start stepping into that role where you are asking those questions, we do genetic profiles in our perio practice consistently. Any member of your family ever lose a tooth to gum disease, experience stroke, heart disease, upper respiratory tract infections, diabetes, certain types of cancers, adverse pregnancy, all the things, right? We're asking our patients those questions. But I think it dials back to something even deeper, which is dental hygienists, first and foremost, are even nervous to ask their patients if they have HPV. Mm-hmm. They're nervous to ask their patients if they've been vaccinated against HPV. So there's that uncomfortability that we have having those conversational pieces in the medical space. And I think one piece that I, as a periodontal hygienist, going from a general practice into perio, really started to get comfortable with was seeing how our periodontists and my perio hygiene colleagues would talk to patients about their medical history. And it was, I'm a medical provider. I'm considered a specialty of medicine in that I treat the oral cavity, but I am a medical provider, and I'm here to talk to you about your medical conditions. And I think being in that space helps to normalize it quite a bit.
And when we look at what patients want, we think they don't want us asking them about their medical history, but, over 3/4 of patients are very open to having not just their medical history taken, but screenings for medical conditions done in the dental office. So it's not the patients. That's on us.
Yeah.
It's interesting. I feel like the environment that is dentistry today promotes the emotional piece rather than just the logical piece. Mm-hmm. And it's important to have that human element and obviously relate to patients, but to your point, if our circumstances were set up where we're just presenting what is objective truth and we're here to help versus, oh boy, this patient's not going to like me today.
I think that's so hard too, because we desperately want our patients to like us.
More than trusted, right?
More than trusted.
That feels like a dental thing.
You're spot on. And it is hard because it's linked to your Google reviews and your Yelp reviews. And I mean, there's nothing that hurts a hygienist's heart more than hearing, can you put me with the other one next time, right? Unless it's a pain in the butt patient, then that's a different story, right?
Yes, I can.
I will let you see that, but, we want our patients to have a delightful time. We want our patients, we are seeing a lot of spa dental, integrations and things like that. We want patients to feel comfortable. We want them to, really lean into feeling like they belong there. And that's fantastic, but we also have to your point, create that narrative of the reason why you're here is because we're partnering together to help improve not just your oral health, but your overall health.
But it can be done well. And it can be done.
Yes.
I went from having a hygiene team back in the day who prioritized cats and recipes and vacations.
Oh, the beauty shop talk.
Yep. Absolutely.
Yeah.
This is my patient. We love to talk about the cape. And I'm like, okay, that's great. Meanwhile, you look at their gingiva and they bleed.
Yeah.
But, okay, cool. Let's talk about the cape. So it's interesting how, you can still create rapport. And I think that's something people get fearful of is, if I'm going to be super medical in my dental appointment, how do I create rapport? But you you can still do that. And it can be done well. And it can all be done within the confines of a normal dental hygiene appointment.
100%.
And in addition to that rapport, now the patient has respect for their dental hygienist as a high-level medical care provider. And I think that that is something that a lot of times, you know, on those days where we feel like we want to hang it up at the end of the day, you know, part of that is that we feel disrespected.
Yes.
And the more that we can create that environment where we are delivering care that's at the level we want to deliver, that we feel like we are doing excellent for our patients, the patients will respect us, and we will, you know, have that job satisfaction at the end of the day.
I think that's important to share that there's a possibility that we can be likable to our patients by actually doing our professional work. And I think that's important. To your point, I think when you connect with a patient on a very superficial level, we both jazzercise at the same jazzercise gym, and that's why the patient likes you and continues to come back in and see you, we're missing that deeper layer. I appreciate that my patients like me and come in to see me because I'm monitoring the quality of their tissue, A1C evaluations. I'm monitoring their blood pressure. Their pulse ox was weird last time, so we talked about it, and I gave them some recommendations, and now we're going to reevaluate that. I like that I have a likabilityness with my patients because I deliver clinical excellence. And so I think that is the mind shift that we have the opportunity to create.
Yeah, look, who taught dentistry that it needed to be either or?
Right.
Yeah.
Right.
Yeah, exactly. Yes, and man.
Right.
Absolutely. You know, it's interesting too, especially like I bought a legacy practice. I had a practice that was 32 years old, and we literally changed everything in 2020. So at that point, the practice was 38 years old. And so there were patients that were patients the entire time. One of my favorite 3 little words, we now know.
Yes.
You know,
Yes.
one of those things where you have a patient that's been going through the same thing every 6 months, and we now want to bring them down to 4 or bring them down to 3 or sometimes bring them down to 2.
Yeah.
It's because we now know. And I feel like that's such an important point to get an existing patient to change their mindset. And it's really hard for a hygienist to come in and say, you know, oh, that new girl or that new person said that I need to whatever. You know, we have to celebrate that, and we need to promote that. And I, at least in my office, if I have a patient that provides any bit of pushback, I'm like, hey, man, I don't apologize for being the most aggressive in this room, because if we can get you healthy, you never have to go see me in the back.
Right.
So,
Yeah.
you know, we're doing our job here, you know, so that I don't have to do more work back there.
What did we say the other day? It will never be quicker, cheaper, and easier to treat disease than it is today. It's not going to get quicker, cheaper, and easier.
Yeah. Yeah, I think that's an amazing concept that you bring up about just kind of that dichotomy of where we are in dentistry. And I think with the more that we're evolving in science research, new technologies, new protocols, I mean, you can take radiographs and have AI read that, and you can take a salivary sample and learn so much about your patient just by getting a little vial of saliva. I mean, it's incredible. And I think, to your point, dentistry is kind of hid behind that a little bit. There's this fear of, well, if I introduce this new thing, the patient's going to think that whatever I did on them 6 months ago wasn't a good job. And we don't celebrate it. Yet you go into a medical facility and now they're like, hey, this new
We're using a robot to take out your prostate now or whatever, right?
And patients celebrate that.
They put a billboard up about it, like, oh, they got a new robot.
Exactly.
New robot.
It's going to be non-invasive, and we're using, doing it under endoscope and all these different things. And the general public celebrates that. In fact, that will actually be a reason why they would decide to see that doctor or to see that surgeon. But dentistry tends to kind of, now when we have a new piece of technology available to us, oh gosh, how are we going to integrate that, and how are the patients going to take it?
And the patients are going to think, well, I bought that CBCT with my bite wing I got last month.
Yeah.
I tell you, it's crazy. So I love this conversation, but I want to like kick it back old school a little bit.
Ooh, we're going OG.
We're
doing it old school, way back, play back.
Because you guys gave this presentation here at RDH Under One Roof, and this is clearly not your first rodeo together. I want to hear about your first rodeo together.
Oh,
Tell us
is
about
good.
your first time.
This is good.
it was a blind date.
What does that
She made me
mean?
buy her. No, I'm kidding.
I probably did. And I'm not a cheap date either. Dr. Mia knows that.
She is the dental wine hygienist, so she does have excellent taste and expensive
That's
taste
right.
in wine.
Yes.
No, so we were set up on a blind date at a speaking conference, and they sort of called us both up. They wanted a preventative talk. They actually didn't tell us at all what to talk about. But they said, we want this preventative talk. And oh, by the way, they told me you're going to be doing this with a hygienist that you've never met. Her name is Katrina Sanders. And then they told her, you're going to be working with a periodontal.
Exactly. You're going to be working with a period, which I was obviously very excited about.
I don't know. Have you met
great.
some of us? We're weird.
I work with a lot of you. You are weird.
It's fine. I own
hope none of
that.
my
I
doctors are
resemble
listening.
that comment. Yeah, and so we got on the perfunctory Zoom. It was 2019. Got on the perfunctory Zoom, and we said, okay, we got to sketch this out. And then we just started like spitballing back and forth. And I think we hung up from that Zoom, and I was like, oh, this is going to be okay.
Yeah.
It's going to be all right. We'll be all right.
And it was more than all
It
right.
was
It
so
was
fun.
amazing. We
Yeah.
had such a great time. And from that, it's really sparkled not only a friendship, but an incredible collaboration. And I think you and I have been able to push off of each other a lot and, share ideas and share concepts.
And get like perspective. It's
Yes.
really helpful for me if I want, the hygienist perspective. Katrina's my go-to gal, where I'll say, what are you hearing about this in the hygiene space? How is this being perceived? What do you think when you're in the room talking to hygienists? How are they viewing, X, Y, or Z new technology, whatever it is? And that's been really helpful for me. We've worked together. We've written a couple of papers together. We wrote a course for
We did.
DACE
Yes,
together.
you
Yeah,
did.
yeah.
Awesome.
And, we've done some speaking engagements together. So this was so fun. You can't tell because Katrina's dressed up because she received an award, but we did coordinate our outfits and our
We
sparkly
did.
shoes.
Yes, and our
together.
shoes. We always coordinate our shoes.
Yeah,
It's like our thing.
Whoa. Shoe game.
Oh no,
There's a
the
shoe
shoe
game.
game is don't look
Amped.
don't look at mine
Don't look
right
down.
now.
Is the camera focused from the table up so we don't have to worry about the shoe game?
That was by design. Thanks, Caroline. My conference run around the place shoes.
Oh,
Yeah.
Comfort.
they're for comfort. Yeah.
Listen.
Yeah.
You'd love my closet if you could see what I have versus what I show at a show.
I got to see the inside of Mia's closet the other day. She sent me some pictures. It was pretty impressive.
We were picking out shoes, and I was taking pictures of my shoes in my closet. And at some point, I said, "Oh, I have this pair of cork shoes with sparkles."
She has shoes made of cork.
No, correction. I have two pair of shoes
Okay,
made
sorry.
of cork. I have a little bit of a problem, but that's why they call me the periodontal heels.
So do you supply the corks?
I know, I was just going to say, I'm sure I contributed
part of
quite
the
a bit to that.
collaboration?
I mean,
It's the circle of life.
we got to get on that.
Shoe building. We are shoe building. I love it.
That would be incredible.
Don't you think?
Yes, you should. A
Yeah.
dental wine hygienist shoe.
She does have her own label, private
That's
label
true.
for
Yeah, I
wines.
do.
Yeah.
Now I just need to get on the shoes part.
I mean, let's do it.
You just got to keep drinking. Keep that
yes,
coming.
yes. I will volunteer as tribute.
Speaking of which, let's talk. Can we talk about wine a little bit?
Sure.
What, what is it? It's July right now. So we're still summertime, still summer vibes going into fall.
yeah.
What are we drinking?
What are we drinking? What are you drinking, Dr. Mia?
I mean, summertime, hot outside, you got to go rosé.
Always.
Okay.
Oh.
Rosé all day, baby.
Rosés all day.
We are having mimosas tomorrow morning for an Instagram Live.
That's
if
true.
people want to follow at the Dental Wine Hygienist, we're gonna talk Perio and drink mimosas at 9 a.m.
Because
Mountain
there's
time.
nothing better than
8
that.
a.m.
Well,
Pacific.
vitamin C.
Exactly. Exactly.
Yeah, that makes total sense.
I don't see why not.
All right. Is rosé your go-to?
You know, I love rosé, but I do love a crisp white.
Oh, I know where you're going.
New Zealand Sauvignon Blanc. Is that where you're going to go?
I'm going to go there or Sancerre.
I was just going to say a
Sancerre.
Sancerre.
Every time I see a Sancerre on the menu, I order it. That is a sommelier tip. Like if you see that, Loire Valley is just like chef's kiss. It's absolutely amazing. I'm also falling in love with Chenin Blanc. I'm really finding some beauty. Like South Africa is doing a lot. So I'm loving the Chenin Blancs. So yeah, I'm spending a lot in those like crispy whites, minerality, something that's, you know, got a little hit of citrus, tiny bit of floral, but like nothing overpowering.
So
Spoken like a true expert.
Yeah.
Absolutely. Last year I was in no, was it last year? I don't remember. 2 years ago? Something. I was in, whatever. I was in Santorini and I did a wine tour and they talked about like, have you had Greek wine?
Yes.
It is so.
It is crisp. It is beautiful. It is robust. It is
mineral
all the things.
to the next level.
Yes.
It's like, yeah, like.
Well, that's intentional. That's how they plant the grapes. They want it to interact with the sea, air, and they want that terroir to just really be able to speak to, this is where in Greece these grapes were grown. There's a lot of pride in Greece, which is incredible.
Oh, yeah. All roads lead to Greece. That's what they say. But yeah, no, that was very like apparent during our wine tasting, which was super cool.
Well, what are y'all drinking?
I like a rosé. I can't help it. Like I do, you know, I feel like it's almost like in the best way, because I feel like this is super offensive to some people. You know, like there's pumpkin spice and like people who hate pumpkin spice, but there's pumpkin spice season.
Yeah.
This is rosé season for me.
Yes.
Yeah,
it sure is.
Ride the season.
Yeah, Whispering Angel. Like
oh,
that.
I love Whispering
It's
Angel.
like a great, like everyday,
perfect.
easy, yep,
Easy
weekend. How about you?
I'm going to say I'll do a rosé, but I probably lean Sancerre more than anything else.
All right, so you guys are going to split a bottle, and Dr.
There we
Pam and I
go.
are going to split a
Yes,
bottle, and we're good to go.
We're good to go.
Good to go.
Then do we roll into fall? Like we
I'm just
stop.
gonna
We
say,
can't stop at
yeah.
one.
No, I feel like I need a Chardonnay in the fall, like a big oaky Chardonnay.
Oh, I want a Willamette Valley Pinot
I
in the
was just
fall.
going to say, I want
Nice.
a Willamette Pinot.
Willamette, damn it. Let's do it.
We have. I like the season. I'm a big fan. Then I go as it gets a little colder. I got to go big Bordeaux.
Yes. Yep. Something big and just party.
Napa's starting to get spanked by those Bordeaux.
Yes.
I don't know. I'm a Petite Syrah lover, like Petite Syrah and a Zinfandel, like, you know.
Okay.
Yeah, no, that's like my Christmas go-to, like holidays and.
Zinfandel does feel like Christmas, doesn't it?
does. It's got that
like really
holiday
peppery
spice
and
yeah. It is. We typically in the winter months will do a Malbec. We love Mendoza. That's kind of our favorite. There's just something to having a beautiful, robust Malbec. It's got that balance of leather and tobacco, but also that big juiciness. And it really will pair with anything, which is what I appreciate. Because around the holidays, you've got, you know, grandma's green bean casserole that comes over and your neighbor, you know, so you need something that's going to kind of play well with everything. And I think a Mendoza and Malbec does a beautiful job.
Are you guys one of those people?
So thirsty, right?
I know.
And there's wine like right across the way.
And I'm like,
they're taunting us.
They are just playing with us right now. Oh my gosh. I feel like, so I'm the worst. Like, give me like 2 glasses of wine on a wine tour. I'm signing up for the wine club. Like, I'm the worst.
It is embarrassing how much I feel that in my soul.
Yes.
We are going to Napa right around Labor Day, and I've already like warned my husband that we cannot sign up for any more wine clubs. Like, it is out of control.
It's so
That means
bad.
3 more wine clubs.
Definitely.
Are you going to go to Joseph
1 or 2 more.
Phelps? That's one of my favorites there.
So we're having lunch with the pairing at 3 Sticks. We're going to Fela, which is one of my absolute favorites in Napa. 3 Sticks is in Sonoma. And then I think we're going to do Schramsberg.
Champagne.
Yeah.
So
I mean,
good.
Well,
if it's good
sparkling,
enough
it's
for the
sparkling.
White House, it's good enough for us, baby.
Absolutely.
It's been served at the White House since like 1915.
yes,
So
yes.
at every sparkling wine event. So we can make, you know, we can slum it with the
Power through.
president.
Yeah.
Push through it. It'll be good.
Oh my gosh, that's so funny. I feel like every once in a while when I'm in Napa, I'll splurge for a bottle or a wine club, whatever. Inevitably, it's getting opened with a pizza. Like, I feel like I never, like, why does that happen?
You always picture that you're going to like have steak night, you know, and you're going to have these beautiful steaks and you're going to have this whole, and you're going to open it with like your friends all around and everyone's having a good time with this bottle of wine. No, it's like Wednesday night and you're like, I had this Stouffer's lasagna and this works.
And you know what pairs well? This like $300 bottle of red. Yeah, that's what I need to have.
That's the dichotomy.
Yeah.
That's the dichotomy.
It just works with everything.
Yes.
Living your best life.
Yes.
Give and take.
Oh my gosh. Well, okay. So we are running low on time. I feel like we need to like,
Can we do this again sometime?
Yes.
I mean, but next time we have to do it with wine.
Yeah.
And
so we're not just watching the wine. We need to have it at our table here.
We'll end with full circle. We'll end with a gingival health wine fact. So, I mean,
okay, I'm here for this.
Okay.
Yeah.
So the polyphenols in wine have actually been shown to be beneficial to your oral microbiota, and in combination with non-surgical periodontal therapy, moderate consumption of products with those polyphenols, that includes dark chocolate and red wine, has been shown to improve oral health, particularly gingival bleeding and alterations in dysbiosis and plaque content. So everything in moderation, but you can have that glass of wine and feel good about your gum health.
I feel so much better now.
Wow.
And the bow has been tied.
I know. That's just beautiful.
Oh my gosh. Okay. So how can people follow you, and when are you guys going to duet again, and when can people look forward to that?
I mean, when are you inviting us to duet
exactly.
again?
Oh, well, no. I mean, you guys have an open invitation in any aspect of my life, anytime, every day. But no, when will people see you on stage again together? Like that, this opportunity doesn't come up all the time.
So it's actually probably not for a while, because I am the president-elect of the American Academy of Periodontology.
Congrats.
And so starting in November, when I am the president, I really have limited my speaking. I think I'm doing 3 engagements over that presidential year. And most of them are associated with the AAP, the American Academy of Periodontology. But we're collaborating in other ways. And I would say for us, since the AAP sponsored our talk here, it was very nice to be able to connect on this in particular, and to get to give a shout out to the American Academy of Periodontology's Dental Hygiene Recognition Program.
Yes.
So you can go to perio.org/hygiene and get more information about that. You can follow me on Instagram at MiaGDDS, MiaGDDS, or hashtag Periodoc and Heels. And I mean, probably they're already following you, Katrina, because you're like a social media superstar.
Oh, hardly. I just like to live my life out loud. You can find me, Katrina Sanders, on Instagram at The Dental Hygienist.
Well, I got nothing else. I'm ready for a cocktail. How about you?
Yeah, it's cocktail
you know
hour.
what? I think Dr. Mia wrapped that up perfectly.
Yes,
so
she did.
Thank you both for being
Let's
here.
improve our gingival health together.
Let's do
with
it.
a glass of
It's
wine.
almost your obligation at this point. We've been talking about gum disease so much.
I'm going to go to the bar and just be like, tissue is the issue. Help me out. Awesome.
Oh,
well,
my
thank you for
goodness.
being here. Thanks for watching. Thanks for listening.
We'll see you all next week.
Cheers.
Thank you, everyone, for watching or listening to the show this week, and thanks to our guests and sponsors on this episode.
Please check out our social media at Dr. Pamela_Maragliano and at Dental Economics Official.
Or you can check me out at Ignite DDS or at Dr. David Rice.
And go to dentaleconomics.com to receive dental economics. You can choose to receive DE in print or digitally, and you can also get the details of our Principles of Practice Management Conference on our website.
If you have topics or guests or anything you'd like to talk about on the show, send us an email to dentistryunmaskpodcast@gmail.com, and we will do our very best to make it happen. Thanks again, and we'll see you next week.